Hello everyone, my name is Ankur and welcome to RJPT Simlab simulation. In this video, we will study about the effect of rat insulin and streptozocin on blood sugar level. At the end of this video, we will be able to tell about the effect of insulin on rats' blood sugar level and effects of streptozocin on rats' blood sugar level and the combined effect of insulin and streptozocin on the blood sugar level of rat. So now let us start with the video. At first, let us see the introduction part. The introduction says this study investigates the effect of rat insulin and streptozocin on blood sugar levels. While insulin is expected to lower glucose levels, streptozocin, a compound that selectively destroys insulin producing beta cells, is anticipated to induce hyperglycemia. The aim is to evaluate how each agent alters blood glucose and their potential interplay in diabetic models. The paragraph says that this study is involved with the to study about the effect of rat insulin, the insulin effects on rat, and the effect of streptozocin on the rat's blood sugar levels. In this case, that we know that insulin is expected to lower the glucose levels. We know that insulin lowers the blood sugar level and blood glucose level. And streptozocin, that is a drug which destroys the insulin producing beta cells. There are insulin producing beta cells and streptozocin destroys those beta cells and is then anticipated to induce hyperglycemia. Let me tell you what is hyperglycemia. Hyperglycemia is a condition where there are high levels of glucose or sugar level in the blood and most commonly affecting the people with the diabetes. So, increase in the blood sugar level in the blood sugar level. Okay. Then the aim is to evaluate how each agent alters blood glucose levels. So the main aim is to evaluate how each agent, which means insulin and streptozocin, alters the blood glucose level and their potential interplay in diabetic models. So here we are taking two agents: insulin, which reduces the blood glucose level, and streptozocin, which increases the blood glucose level by destroying the insulin producing beta cells. So it stops the production of insulin by destroying the beta cells, which can also induce hyperglycemia. So now let us see the equipments required for this experiment. At first we need animal, which for that we are using rat. Then we are using drug. We are using two drugs, insulin, which lowers the blood glucose level, and streptozocin, which increases the blood glucose level by destroying the beta cells, which produces insulin. Then instrument. We are using instrument glucometer. The glucometer is a device which is used to measure the blood glucose level. Now, let us see the principal part of this experiment. The principle says the principle of the study is based on opposing effects of insulin and streptozocin on blood glucose levels. Insulin promotes glucose uptake by cells, thereby lowering blood sugar. So, the principle is based on the effect of opposing effects, which means insulin and streptozocin. As we know, both the substances produces opposite effects, including where lowers the glucose level, and streptozocin whereas increases the blood glucose level. Let us know how does insulin lowers the blood glucose level. Insulin promotes glucose uptake by the cells, which means the insulin increases that the cells insulin increases the uptake of glucose, which means absorption of glucose by the cells. Insulin increases the absorption of glucose by the cells, thereby lowering the blood sugar level or blood glucose level. The glucose inside the blood from the blood is absorbed by the cells. And in contrast, streptozocin selectively damages pancreatic beta cells, reducing insulin secretion and causing an increase in blood glucose. So, in contrast, which means opposite, the streptozocin works on opposite effect. How it works? It damages the pancreatic beta cells, which means the streptozocin damages the beta cells present in pancreas. As we know that pancreas produces insulin, so the beta cells present in the pancreas are damaged by the streptozocin drug. That's why it reduces the insulin secretion and that causes an increase in the blood glucose. This is the opposite effect. So by administering these agents, the study aims to observe their individual and combined impacts on glucose regulation. Now, let us see the procedure part. At first, we have to do by using tail snap withdrawal method, take blood out of rat. So, for we have to perform this method, we have to perform tail snap withdrawal method. By this method, we withdraw blood from the rat by withdrawing blood from its tail vein. We have to take blood out of rat. Then we have to check glucose level of the blood using glucometer. Ideally, the value of normal glucose is 82 milligram per dl. Now, then after that, by using an intraperitoneal route, insulin to the rat, then further withdraw blood from the rat and measure blood glucose level. Ideally, the value comes out to be 72 milligram per dl. So the third step says by the intraperitoneal route, we are using intraperitoneal route, which we directly inject the drug inside the abdominal cavity of the animal. So by the intraperitoneal route, we are administering insulin to the rat with the help of a syringe, and then again further we will withdraw the blood from the rat, and we will check the blood glucose level. Then it should and the blood glucose level then should come around about 72. Then further inject streptozotocin by using intraperitoneal route and wait for 4 days to show its effect. Then after the insulin administration, we have to administer streptozotocin drug by the same intraperitoneal route into the abdominal cavity with the help of a syringe. And then after that, we have to wait for 4 days to show its effect, the effect of streptozotocin. Then again, we have to withdraw blood from the rat and measure blood glucose level. And preferably, the value comes out to be 115, which means again after waiting for 4 days for the streptozotocin to show its effect, we will check the we will measure the blood glucose level and it should come around 115. Then take new rat by using tail snip withdrawal method. Take blood out of the rat, then check glucose level of the blood using glucometer. Preferably, the value of the normal blood glucose is 80 mg. So now we have to take a second rat, and again by the tail snip withdrawal method, by withdrawing the blood from the tail vein of the rat, we have to take blood and then we have to measure the blood glucose level by using the glucometer, and then normally it should come around 80. Then further inject streptozotocin by using intraperitoneal route and wait for 4 days to show its effect, and then introduce insulin to the rat by intraperitoneal route. So, after that, we have to inject the streptozotocin drug through the intraperitoneal into the abdominal cavity. And then we have to wait for 4 days for the streptozotocin to show its effect. Then, which means by this streptozotocin, it will increase the blood sugar level. As we know, as by injection, we have seen that it has increased before for the rat one first rat it has increased to 115. It has shown that it has increased to 115. But similarly, if we will do it for the second rat, but after the effect of streptozotocin, we have to introduce insulin. We will introduce insulin by the same intraperitoneal route inside the abdominal cavity, which will lower down the blood sugar level. And then we have to again withdraw the blood from the rat and measure the blood glucose level. Preferably, the value should come around 92. So, we will have to observe this by performing this experiment. The conclusion. Now, let us see the conclusion part. The conclusion says that the study concludes that the insulin effectively lowers blood glucose level while streptozotocin induces hyperglycemia by damaging pancreatic beta cells. So, the study aims that or shows that insulin effectively lowers down the blood glucose level, and while opposing the streptozotocin induces hyperglycemia by damaging pancreatic beta cells. So these findings confirm the opposing roles of the two agents and highlight their usefulness in studying diabetes and glucose regulation in experimental models. So by confirming these findings and the opposing roles of the insulin and streptozotocin, the two agents, they are get very useful for studying the diabetes and glucose regulation in experimental models. As we can see, this is the ideal observation table that is drawn for this experiment. It shows the parameters and the values. At first, we have the normal control analysis of the blood glucose level, then after the insulin administration, and again after the streptozotocin administration. And then for the second rat, again with the insulin analysis, and then after the streptozotocin and insulin combined analysis. Now, let us perform this experiment and study it. And for that, we are using our RJPT's simulatory laboratory. As we can see, this is the UI interface of our simulatory laboratory. On the left side of the toolbar, we can see our animal rat is placed. On the right side of the toolbar, we can see that we have our instruments that we will use while performing the experiment. We have a rat holder and a, and a syringe. On the bottom side, we can see that there is an instruction part which shows the procedural part for performing this experiment. So now let us start with the experiment. The procedure part says, let's first check the glucose level of the normal rat 1. So according to the procedure, we have to check the blood glucose level of the first rat. As we can see here, we are taking out our first rat and we are placing inside the rat holder. And by the tail vein, we are withdrawing the blood through the capillary tube, and this is the glucometer. As we can see, this is the blood glucometer which measures the blood glucose level. And after withdrawing the blood from the tail vein of the first rat with the help of the capillary tube and the incision that we have made, we have to collect the blood with the help of capillary tube and place inside this blood glucose strip, which is connected to the glucometer. We have to provide the blood to the glucose strip and then attach it to the glucometer. Then the glucometer will show the blood glucose level, which is, as we can see, our first rat has shown a normal blood glucose level of 82. Now, after this, we will place again for our first rat inside the cage. As we can see, this is the rat holder. This is the knife that we are using to cut the cut the tail cut the tail vein and withdraw the blood with the help of capillary tube, which is known as the tail snip method, withdrawal method. Now we will move on to the next step. We have to inject insulin to our first rat. Now, by clicking this inject button, we will inject insulin to our first rat. We will carefully take our first rat from the cage and through the intraperitoneal route, we will inject our insulin. And now we have to wait for it. On the top side, as we can see, we have our observation table. That's the same observation table, and after performing each step, the value has been written over here. As we can see, for the normal analysis, we have measured 82 value, 82 blood glucose level. We can close it by clicking this button. Now we will move on to the further next step. By clicking this next button, we can jump on to the next step, or by clicking this previous button, we can move backwards. We will move forward. And now let's check the glucose level of our insulin injected first rat. We will take out our rat from the rat's cage. We have to perform this very carefully so that the rat does not get scared or panicked. We will place it inside this, and with the tail snip withdrawal method, we will take out the blood and then again place it inside the glucometer. The blood glucose level has been shown to 72, which is a decreased value because of the insulin. As we know that insulin decreases the blood glucose level because it increases the absorption of the blood glucose from the blood to the cells. The cells absorb the glucose from the blood. Now we will jump on to the next step. Again, we will place our first rat inside the rat's cage. Now we'll move on to the next step. Now we will inject the streptozotocin drug to the first rat and wait for 4 days. So by clicking the inject button, we will take out our first rat and we will administer to the intraperitoneal route inside the abdominal cavity of streptozotocin drug. As we know that streptozotocin will kill the beta cells, pancreatic beta cells present inside the pancreas, and it will decrease the production of insulin. So the blood glucose level will be increased. We will move on to the next, and now we are checking the blood glucose level of rat 1 after 4 days. So now we will check by clicking the check button, and again with the help of the rat holder, by the tail snip method, we will withdraw the blood from the rat's tail and collect it with the help of a capillary tube and place it inside the glucometer. So as we can see, an increased blood glucose level of 115 has been shown by the glucometer. It is because of the effect of the streptozotocin, which has increased the glucose level by destroying the beta pancreatic cells, which produces insulin. Now we will jump on to the next step. Again, we will place inside our first rat to the cage. and move on to the next step. Now we are taking the new rat named as the rat 2 or second rat, and now we are injecting streptozocin drug and waiting for 4 days and then injecting insulin to the rat 2 on the fourth day. So now we are taking another different rat, and in that rat we will see the combined effect of streptozocin and insulin. And for that, at first we will inject the streptozocin drug and wait for 4 days to show its effect. Then after the fourth day, on the fourth day, we will inject insulin and then we will check the blood glucose level. So now at first, let us inject the streptozocin drug through the intraperitoneal route to the rat. But before that, we will check the blood glucose level of the second rat to make a base value. So by the tail snip method, we will withdraw blood and we will check the blood glucose level. As we can see, the blood glucose level is 80, which is a normal value. So now we will place it inside the cage again. And now we will jump on to the next step. As we can see, we have beforely placed the syringe pre-filled with the insulin and the different syringe pre-filled with the streptozocin drug over here on the table. So now we'll inject both the drugs and check the blood sugar level. So now we will take the second rat out of the cage and we will inject the streptozocin drug through the intraperitoneal route inside the abdominal cavity. And now we have injected streptozocin drug. We have to wait for 4 days. So by clicking the skip button, we can wait. We can skip the waiting period of the 4 days. So we'll skip this part, and now we will inject the insulin through the intraperitoneal route again on the fourth day. We have injected the insulin. We have injected insulin, and now we will check the blood glucose level of the second rat. We will place it again inside the rat holder. We will close the lid so that the rat does not move away. And with the help of the tail snip method, blood withdrawal method, we will take out the blood. And as we can see from the glucometer, the value has been shown to the 92, which is an near about ideal value. So again, we will place the rat back inside the cage. And as we can see here from the observation table, this is the value of these are the values of the parameters, different parameters, the normal condition, insulin condition, streptozocin, insulin analysis, and both the effect. So again, we will check the blood glucose level of the second rat to confirm its blood glucose level so that no chance of any error is there. Again, with the help by the tail snip blood withdrawal method, we will withdraw the blood with the help of capillary and place it into the glucometer. And as we can see, the glucometer has shown 92 value of the blood glucose. We will jump on to the next step, and again we will keep the rat inside the cage, and then we will jump on to the next step. So now, as we can see, we have completed our experiment and we have came to the result part. And as we can see, this is the observation table that we have filled with our observations. It shows that the normal condition, normal control analysis has shown 82 blood sugar level, and then insulin, after injecting insulin, it has decreased the value of blood sugar to 72, and after that, we have injected streptozocin, which has increased the blood sugar level to 115 for the first rat. Then for the second rat, for the insulin analysis, we have measured before administering any drug. So we have observed the 80 blood sugar level, and after that, when we have at first injected streptozocin and then waited for 4 days, and then on the fourth day we have administered insulin, and then we have checked the blood glucose level, then it has shown 92, and we have confirmed it twice, and it has shown 92, which is near about an ideal value which maintains the blood glucose level even after increasing of this by the streptozocin drug. So the result showed that the administration of insulin significantly decreased blood glucose level. We have seen that insulin has decreased blood glucose level, indicating enhanced glucose uptake, in which indicates the enhanced glucose uptake by the cells from the blood. And in contrast, rats treated with streptozocin exhibited a marked increase in blood glucose level, confirming beta cell destruction and reduced insulin production. So what we've observed in contrast in opposite effect, that the rat when the streptozocin drug, the rats in which we have administered streptozocin drug, they have shown increase in the blood glucose level, as you have seen, 115. which confirms that the streptozocin destructs the pancreatic beta cells and reduces insulin production, and the blood glucose level inside the blood is increased. So combined treatment reflected the antagonistic effect of both agents on glucose regulation. So after that from the different rats observation to the different rat, we have used the combined effect of streptozocin and insulin, and it has shown antagonistic effect. That even after streptozocin's effect, insulin has shown its effect and decreased the blood glucose level. Even after streptozocin's increased value, and has shown a good blood glucose regulation on due to the both due to the combined effect of the both agents. So we have understood the effect of streptozocin and insulin and the combined effect of streptozocin and insulin. So now we have completed our experiment and we have come to the end of this video. I hope that you have learned a lot in this experiment and in this video about the effects of streptozocin, insulin, and the combined effect of both streptozocin and insulin. So now we have come to the end of this video. Thank you guys for watching this video. For more such learning content, subscribe to our YouTube channel RJPT Informatics. You can also follow us on our LinkedIn profile, on Instagram page, as well as in Facebook. We update and upload our such learning content over these platforms. Thank you.